Dentca tray impression, and Tryin and final delivery. Regarding complete denture impression techniques, the custom tray has been used in the past decades and is quite well accepted. In the clinic, we're gonna use special customized Dentca tray for the complete denture impression, and the photo of patient will be used. There's also intraoral scanning impression technique available, and in immediate denture case or partial denture case could be used with the intraoral scanning technique. If patients are fully edentulous, then we are using Dentca tray impression technique. So we will take a look at in detail about this special tray. The tray using three basic philosophy. One is the one-step impression, which discussed by Carson. And instead of taking preliminary impression and making custom tray, and then taking final impression, that's called two-step impression technique. This one, we're using the prefabricated plastic tray, and we modify the plastic tray, and the same appointment we're taking final impression. So we call one-step impression. And also this one-step impression using heavy body PVS border molding described by Dr. Bernard Levin. Using the fast setting heavy body PVS to customize the border of this tray, and then we are going to take light body PVS wash impression described by the Singh. And two-step border molding is first one, you loading the fast setting PVS, hold it for 10 seconds with a very light press. First movement is labial frenum activation by pinching the upper labial anterior portion, and that's the first step. The second movement is maximum opening and close. Again, this practice patients should perform maximum opening and closing. Regarding mandibular, same thing, the holding 10 seconds. First step of mandibular border molding is lingual movement, and then second is maximum opening and closing. You're going to repeat this movement for 4 to 5 times. The first thing is there is a 4 different sizes of the tray available. You need to choose whether small, medium, large, and extra large tray based on the patient size. And once you choose the tray size, we are going to use the fast setting heavy body PVS. Load it into the tray fully, and you take the two-step border molding for maxilla. Same thing, heavy body fully loading onto the tray and do the two-step border molding. And once you complete PVS heavy body setting, you remove from the mouse and you evaluate the impression. Now you notice that there is some acrylic of the tray show through this heavy body PVS. These area showing that the area is either overly extended or has compression on the soft tissue. Therefore, before we taking final light body PVS impression, you need to adjust this tray. So this one is showing with acrylic burr using adjust any area that is shown through the heavy body PVS, and for the maxillary and mandibular also you need to adjust the area that has a tray is showing through. So you are modifying tray size by observing the faceting heavy body PVS impression. Once you complete it, then it's ready to take the final wash impression using the faceting light body PVS. And this light body PVS should cover very gently and cover entire surface, not only the internal and the border around it. Maxillary impression and the final impression. This is when its impression is complete, following the same two-step photomolding technique. Once you complete the impression, maxillary and mandibular wash impression, the next step is now we are going to take the CR centric relation and the vertical dimension measurement. This particular special tray does have a separation in the back side. So the tray, instead of having one piece, this is a two-piece tray assembled in as one. So for the maxillary, you need to mark where is this first anterior posterior section piece junction, and following the junction, you use the blade to cut it through your impression itself. So you cut the PVS first and make it jiggly loose by holding anterior posterior piece separately and then separate it from each other. Also, the mandibular impression tray need to be cut as shown here using the blade. For the mandibular tray also has distal pieces detachable. So we're gonna cut the PVS impression first before you detaching anterior posterior pieces. And this is showing you after you cut it, distal portion. Now, as we discussed in other section, we are doing graphic recording, finding CR position. So this is intraorally, so making the Gothic arch tracing mark and identifying where is the CR position. And of course on the mandibular, there's a Gothic arch tracing pin attachment are built into this tray. So you attach this pin first onto the lower tray and then do the graphic recording as we discussed in other chapter. You could use one of the three techniques. Either you could use the direct check bite technique or Gothic arch tracing or short Gothic arch tracing method. Again, this one, instead of doing the lateral movement, you're only asking the patient to move forward and backward. Now, once you identify the centric relation position, CR position, we are lock the position by using the bite PVS registration, fill this space into it, and to achieve the centric relation position. And then vertical dimension determination, as we discussed in previous chapter. This is the patient smile. This is patient resting position. So we call the vertical dimension of rest. And this is the vertical dimension of working length. Again, you could see this anterior piece, maxillary mandibular anterior piece with the CR bite registration are in the mouth. And we are using the jaw gauge ruler and measuring the working distance and measuring. So this is a working distance, 97 millimeter for this particular patient. And when we measure the patient resting vertical dimension, which was 92, therefore 92 minus 3, because the patient is class 1 relationship, and minus 97. So the difference between these two adjustments become minus 8. So we are going to adjust and reduce the vertical dimension 8 millimeter. This is how you're using the jaw gauge ruler from the chin, bottom of the chin to the bottom of the nose. And you need to repeat this one at least 3-4 times when you're measuring the working length and the rest length. So make sure you check 3 or more times to get the consistent measurement with the working length and the rest position length. And then this is the worksheet for complete denture. First, you need to write down the name and the exam number and patient name. You need to identify the patient gender and case type. You always include the Tryin. You need to select the teeth shade color, and these are the available teeth color. And also you also need to check the gum shade, and light pink or light reddish pink, original pink, and dark pink color. So there's a 4 gum shade available for complete denture. And also you need to measure the upper lip length using the ruler and identify how many millimeter of the patient is needed to determine incisor length position. And the next step is desired anterior overjet. Again, for the regular class 1 patient, or patient has a class 2 retrognathic tendency, or if in case the patient showing the prognathic jaw relationship, then you mark class 3. You also need to mark it tray size that you use for the impression taking, small, medium, large, or extra large. Then you also choose the teeth mold shape, whether you're going to use the universal shape or oval shape for usually for feminine looking, or square shape for masculine looking. So these are the worksheet that you need to fill it out with the patient. And once after patient dismiss, and this is using the lab scanner, scanning your tray impression. Or you could use intraoral scanner to scan the impression. Now, this one I discussed in different chapters, so please make sure you watch two-step photomolding impression and the scan instructions separate from this lecture. Once you get the 3 STL file after scanning, then use the design software to design the complete denture. After you complete the designing of the complete denture, then you got the final printable STL file. Then we're printing Tryin denture for testing. So this is the image of printed Tryin. And this printed Tryin has a multiple purpose. First one, we are evaluating aesthetic of patient. And we also check the occlusion of the denture that we just designed. Since this Tryin denture could be wear and by the patient, you could test functionality of this printed Tryin denture. So you could check with the patient, make sure the patient could eat well, speak well, and get used to with this Tryin denture, so that you know exactly what you're going to manufacture for the final denture. And also, you could check the vertical dimension, and we are checking the different teeth setup, whether the patient, make sure the patient likes the way we set it up. And also, you could compare class 1 or 2 or 3 relationship is needed if the patient comes with different jaw relationship. This is an example that we tested with the 2 different Tryin. Patient request more natural setup rather than very straight setup. So first thing, we set it up as a feminine letter setup. So you could see this particular Tryin T setup as a more feminine looking setup. We're also making another very crowded setting. So as you look at the mandibular teeth and the maxillary, as teeth are overlapping and crowded. It's called a natural crowding setup. And we evaluate the two different Tryin and see whether which Tryin patient would like to have it as her final denture. So Tryin denture will be wear by the patient, evaluate the aesthetic and occlusion, and make sure the patient is happy with the way it looks and also the functionality of the Tryin. Once the Tryin is confirmed after patient wearing, then you could order final denture, or if the patient requests some modification, then you could, before you making the final denture, you modify those things. Patient is wearing the exact same identical final denture, and this is when his patient received the final printed denture after she confirmed the Tryin. When it comes to Tryin denture, you may provide some staining to make more realistic denture filling. So when it's printed Tryin has a monochrome chromatic color, and you could use the PMMA staining kit to stain the Tryin denture as is shown here. When the Tryin delivery, if the Tryin need to modify, especially for internal surface, so the fitting of the Tryin is not good or great, or stability is not there, then you are doing wash on the Tryin denture, and step will be exactly same. First, heavy body around the border only, not internal, and then taking light body fast setting PVS, we take the impression on the Tryin, and then you scan this Tryin impression to get the better tissue adaptation portion. So this is another sample of Tryin. The border was quite underextended. So we used two-step border molding impression technique, one with a heavy body around the border and the light body fast setting PVS wash impression on the Tryin. And then the final denture will be fabricated in much better fit, and basically it's the ideal fit because we change the length whenever it is needed. So this is the final denture printed. Delivery maxillary complete denture. How do you feel?
Great.
So your story was like a few months ago. You came in. You had a teeth back then,
Yes.
and we did impression.
The impression.
We did the kind of like picture taking, correct?
Yes.
Yeah. And then after that, you got the 2 times teeth removed
Half
separately.
teeth taken out, and then a month later, got the other half taken out.
And then after the teeth taken out, you had a temporary one.
Temporary.
Which you just had it, right?
Yes.
And you had that one for about 2 months.
2 months.
Yeah. And then after tissue completely healed,
Then
you got the new wash, and then you got this one today, correct?
Yes.
Do you feel any difference?
100 times better.
All right.
Yeah. Any sort? No. 100% better.
Look at my teeth.
Hold up.
And I never had braces either.
Hold up.
Oh, this? Here, help me here. Get it up. Here, I can do it now.
Oh, that's.
Isn't that amazing? I know it. That's what I said. I was so happy. Totally.
Patient got the final denture, and she was so happy that she is showing her old picture, saying that her denture never looked like her original teeth until now. And she was showing her old picture compared to the new denture that we just delivered, and explaining that she's unexpectedly happy with outcome of the denture. This is how we fabricate the digital denture.